Hello, good morning, and welcome to this press briefing of the Africa CDC. It is the usual briefing that we bring to you every Thursday, and we are joined as usual by our host, Dr. John Nkengasong, who is the director of the Africa Centers for Disease Control and Prevention. My name is Wayne Musabayana, and we're coming to you live from the African Union in Addis Ababa. So Dr. John today will give us the usual brief on the situation of COVID-19 on the continent. And I'm sure he will also touch on the issue of those vaccines, because last week you heard the briefing from Mr. Strive Masiwa on the movement, the beginning of the movement of those 400 million doses of the J&J vaccine to different member states across the continent. So I'm sure today Dr. John will be briefing you on progress with regards to that and other vaccine-related information. When we do come to our question and answer section, please feel free to utilize that WhatsApp number, and that is +251 94 550 2310. That's +251 94 550 2310. The live link is also open for you to utilize, as is the question and answer section on this Zoom platform. So let me now invite Dr. John Nkengasong, the director of the Africa CDC, for his briefing before we go into our question and answer section. Dr. John, it's over to you.
Thank you, Gwen, and good morning to everybody on this platform today. Greetings from the Africa Centers for Disease Control and Prevention in Addis Ababa. So let me, as usual, do three things. I'll give you the epidemiological update of where we are with the pandemic on the continent, and then discuss what we are doing as Africa CDC to support member states, and then conclude with the issue of vaccines and vaccinations. So let's start with the epidemiological situation. As of today, August 12, 7.1 million cases of COVID-19 have been reported across all 55 member states. Of that number, unfortunately, 179,000 deaths have been recorded, and that represents a case fatality ratio of 2.5%. If you factor in the 179,000 deaths recorded on the continent as a percentage of the global deaths, it represents 4.2%. The following 5 countries represent the most caseloads, that is in excess of 60% of the caseloads. They include South Africa with 36%, Morocco 10%, Tunisia 9%, Egypt and Ethiopia 4%. In terms of the third wave, 60% of our member states, that is 33 countries, are now experiencing the third wave. 26 of them, that is about 80%, are experiencing a very severe third wave. The definition of a severe third wave is where the peak of that, the third wave is higher, significantly higher than that of the second wave. And since the last time we discussed, one more country, that is Guinea, has joined the group of countries that are experiencing a third wave. 4 countries, Algeria, Kenya, Somalia, and Tunisia, are now experiencing a fourth wave. So again, it just speaks to how things will continue to unfold unless we scale up vaccines. So just a few weeks ago, there was only Tunisia and Kenya, and that were reporting the fourth wave, and now there are 4 countries. So in terms of variants, 42 countries are reporting now on the continent the Alpha variant. 3 additional countries, that is Liberia, Seychelles, and Sudan, have now reported that the Alpha variant. 37 countries are reporting the Beta variant, and 1 additional country, that is Sudan, is reporting that it's a new addition in the reporting of that particular variant. 30 countries are now reporting the Delta variant. And since last briefing, 4 countries, member states, Eswatini, Lesotho, Sierra Leone, and Seychelles, are reporting this variant. So again, it's a remarkable increase in terms of the spread of the Delta variant across member states. So let us now look at the trends over the last 1 week in terms of new cases and deaths. So over the last week, that is between the 2nd and 8th of August, we recorded 270,000 new cases, and this represents 1% decrease from the previous week. The highest proportion of new cases is from South Africa, followed by North Africa, East Africa, West, and Central Africa. In terms of new deaths, a total of 6,300 new deaths have been reported across the continent since last week, and this represents a 1% decrease in the total number of deaths since we last met on this platform. And I really hope that that trend continues. So let us now look at the 4 weeks trend. Over the last 4 weeks, that is the period between the 12th of July and 8th of August, we have observed a 1% average decrease in new cases over across the continent. And the following regional trends can be reported: 31% increase in West Africa, 11% increase in North Africa, 8% increase in East Africa, 10% decrease in Southern Africa, and 2% decrease in Central Africa. In terms of new deaths across the 4 weeks period, we have observed a 4% average increase in new deaths across the continent. And with the following trends in the most populous countries: Nigeria, 100% average increase, Kenya, 56%, Ethiopia, 37%, DRC, 34%, South Africa, 2%, and Egypt, 16% average decrease in the number of the deaths. So in terms of testing, we have, the continent has recorded a total of 62 million COVID tests, and 1.3 million new cases where new tests were conducted last week. And I think we continue to see a cumulative high rate of positivity rate of 11.5%, with a test per case ratio of 8.7%. 11.5% represents a very high rate of positivity. It means community, extensive community spread. 31 member states are reporting test positivity rates that are higher than even 12%. So I think that is not, it doesn't bode well for control. So let me speak to what we are doing. I think we continue to support member states to roll up their vaccine and vaccination campaign. Over the last weeks, we have sent swab teams across several member states, including in Cameroon, where they are there supporting the countries to roll out about 500,000 vaccines, and some of which had a very short expiration date. In Zambia, Namibia, Sierra Leone, Zambia, we continue to roll out what we're calling the swab teams. These are teams that go in country, build, start working for about 1 month, and then pull out and rotate to other countries. So in terms of some very important announcement, on the 14th and 16th of December this year, the Africa CDC will host its first international conference on public health in Africa. That is significant. This is the first time that the continent as a whole will be gathering to discuss public health, and the public health dimensions we have seen through the eyes of COVID, that it has a significant impact on economy, significant impact on security, and significant impact on the way of life. So the CDC will be hosting that meeting, and more details will be provided in course of the coming weeks. So let us now discuss vaccines situation as we conclude. A total of 114 million COVID vaccine doses have been procured by 53 member states in Africa, and 77.3 million vaccine doses have been administered across the member states. If you look at those who have received 2 doses of vaccines, that is what we call the full immunization. It represents 1.75% of coverage, which means we are still far removed from reaching our target of 60% by the end of next year. Just to give you some figures, Morocco's full vaccinated coverage stands at about 30.45%, South Africa 0.57%, Egypt 1.83%, Nigeria 0.68%, Tunisia 10.55%. So it's some good movement there in terms of Morocco and Tunisia, but overall the continent is still lagging behind. So let me just conclude by expanding on what Wayne mentioned. Last week, you heard Mr. Masiwa, the EU Special Envoy, discuss extensively on the vaccines that the African Vaccine Acquisition Task Team was going to start distributing. I'm very pleased to announce that that distribution, the first phase, has gone through, and from the time we met last week to now, I'm very pleased to say that 10 countries have now received their first deliveries, and the distribution stands as follows. Egypt has received 261,000 doses of the Johnson & Johnson vaccine, Angola 165,000 doses, Ghana 177,000 doses, Tunisia 108,000 doses, Cameroon 158,000 doses, Mauritius 108,000 doses, Togo 117,000 doses, Lesotho 108,000 doses, Botswana 108,000, Nigeria 177,000 doses. Yeah. Let's put this in the context of total doses required. Remember, this is Johnson & Johnson is one dose. So if you take a country like Egypt with 261,000, if Egypt can manage to immunize the 261,000 doses into the arms of people, that represents 261,000 people that would have been immunized. So because this is a single dose vaccines. In other words, if these were the double dose vaccines, the number would be double. Okay, so but again, this is what I call a programmatic vaccines. You receive it once and the person disappears. We don't need to follow that person up. So I think very exciting movement. The second phase will start soon, and then they will continue on Monday basis as Strive. Needless to repeat what Strive mentioned to you last week, but I just thought I should bring the good news to you this morning. So Wayne, thank you, and I look forward to a very exciting conversation.
Thank you very much, John. And it's good to know that that distribution has started and that number of vaccines have started going out already to our member states. So colleagues, now we are in the question and answer section. And let me just repeat that number, that WhatsApp number for you to send your questions to. It is +251 94 550 2310. We, of course, welcome your live questions as well as those that are coming in through the Q&A section. So let's go over to those that have sent in their questions through the WhatsApp number. And we start with a question from Coletta Wanjohi, who is with FSN. Coletta says, with the Marburg virus reported in Guinea, what plans are you putting in place as Africa CDC to cushion other countries in the continent from that virus, considering that the COVID-19 is already overwhelming enough? So that's from Coletta.
Coletta, very good question. I think the key, Coletta, to what the question of Marburg is that we have to continue to strengthen our surveillance systems. That way we can pick up anything that looks like unusual, deal with it before it becomes a threat. And that is why we are preaching a new public health order for the continent. And we think we have discussed this and published it extensively. And the theme of that conference that I just mentioned will be around a new public health order for the continent. We recognize that disease stress will not attack the continent sequentially, which in other words, meaning that we don't have the luxury of dealing with COVID-19, then we get it over, and then we wait for maybe Zika to come, and then we deal with it, and then we wait for maybe Marburg or Ebola. I mean, we are seeing that even in the middle of this pandemic, we have had to scramble to fight Ebola outbreak in Guinea. the same Guinea that the Marburg has been reported. And now we are dealing with the Marburg outbreak. I just suggest to you that these the disease threats are now all over us, and it's a question of time before you see an outbreak that leads to an endemic disease or a pandemic. So the key to, we cannot prevent the emergence of outbreaks, but we can prevent their spread. So which means if we have good surveillance systems in place, where through the National Public Health Institute, which is a strong instrument, we are encouraging and advising and supporting member states to establish their own public health institutes, which will be the equivalent of a mini CDC. Then we should be able to pick those things early and then squash them before they become a serious threat to the country and to the region.
All right, thank you very much for that. We move on to a question coming from our Q&A section, and it's coming from Judith Akolo, who is with the Kenya Broadcasting Corporation. She says, my question is that the Ministry of Transport in Kenya has allowed public transport vehicles to carry passengers at full capacity, meaning that social distancing is not being observed. What is the advice by Dr. John Nkengasong to the government of Kenya in the face of this new development in the country?
So Judith, the simple response to that is that each time you offer the virus an opportunity to spread, it will spread. And as the virus spread, you get mutations. And as you get mutations, you get variants will emerge. So I think that is simple. That is the easiest way to answer the question in a very broad way, so that it's not just limited to the bus drivers, but any cluster of people that are at least that come together facilitate the transmission of the virus. Now, in order to enable or balance between saving lives and saving livelihoods, of course, people have to move around, but you have to do that with enhanced public health measures. What I expect that the transportation system must have is a good systems for hand washing at the stations where people board. Masking must be compulsory in a bus so that nobody is speaking out and spreading the virus. You have to cut the loss. As I said, it's a balance between lives and saving lives and saving livelihoods. You can win on both sides. So I think if a bus was supposed to take, say, 30 passengers, you have to do some mathematics and make sure that there's some gaps allowed in there so that people don't just sit very close to each other. So I'll leave that up to the government of Kenya to do the right thing, which I think Kenya has the experience now of fighting the first wave, the second wave, and the fourth wave. So I have no doubt that the government would do the right thing and put the right measures in place.
Thank you, John. The next one is related to the previous one, and it's coming from Ayanet Mercy from Reuters. We saw some news earlier on this week indicating that Kenya could be requiring its civil servants to get vaccinated. Is this a measure that you support for the member states of the AU?
I support that all Africans, all citizens of Africa should go out there and get vaccinated whenever they have an opportunity to have access to vaccines, because you are saving yourself, you are saving your loved ones, and you are protecting your community and protecting your country, period. There's no other way of saying it. So we don't even need to get to the level of requirement. I mean, those diseases that we have eliminated, like smallpox, that we collectively, the world has eliminated one disease in the history of infectious disease is smallpox, is because we as human beings put out good behaviors, and which is, we work very closely with public health experts and to do what the public health experts said we should do. So I think if we behave, the right behavior is to go out there, get your vaccine whenever you have access to the vaccines. We don't even want to get to the point where government is requiring that you get vaccinated.
All right, thank you. We are going to move on to a question from Kara Anna, but at this point, I just want to remind colleagues that if you have questions, please send them in now, because we want to be able to capture the questions during this period. So let me come back to Kara Anna, who is with Associated Press, and she says, thank you for the briefing. How long is it safe to wait between the first and second shots of the AstraZeneca vaccine? And will large amounts of the AstraZeneca vaccine be arriving anytime soon in Africa?
Let me start with the second part of the question. Large amounts of AstraZeneca vaccines will not be arriving on the continent anytime soon, because what we are seeing arriving on the continent now are those donations from the Europeans that had the vaccines, and they are now releasing them, whatever they had. I don't think I'll consider that as large amounts. So, Cara, let me remind you all of what you know already, that as a continent, we need 1.6 billion doses of vaccines to get us to 60%. So that context is very important, so that when we receive a donation of 10 million AstraZeneca, we put that in the context of where we should be heading to. So I don't think the only way that will enable the continent to achieve that large scale supply of the AstraZeneca is if the situation in India change, and then India takes a different posture of releasing the vaccines. Then at that point, you see a large scale introduction of the AstraZeneca vaccines on the continent. What is the time line between the first dose and second dose? I think you've heard all the intervals, the range between 4 weeks to 6 weeks. The most important thing is that get your first dose of the vaccine. It offers a certain level of protection for sure. And then, of course, you have to allow the immune system to get used to that first dose, and then mature, what you call the B cells. You have to get matured so that when you receive your second dose, the booster, the reaction is more profound. So anywhere between 4 weeks and 6 weeks is appropriate.
All right, thank you. We move on to a question coming from Mario Baptista, who is with Lusa News Agency of Portugal. Mario says, will the conference in December be online or will it be in person? And perhaps I could add on there to say, can you give more details about what it aims to do and also the involvement of media in that conference?
Wonderful. The conference in December, specifically December 14, 16, will be an online conference. And of course, the media, as you know, Africa CDC always invite media to all events that we conduct, because we believe that that is an integral part of a good public health practice. As I said earlier, there's I was surprised when I became the pioneer director of Africa CDC that there was really no conference on public health in Africa. So that conference will offer a platform for what I call a multi-sectoral approach and discussions and dimensions to public health practice there. If you look at how public health is changing over the last 2 years and even 4 years, it is multi-dimensional. And we have to bring the private sector into this. The private sector doesn't mean the clinics, the private clinics, but even entrepreneurs. Some of the greatest innovations that have been brought to bear to address public health measures during this crisis have come from people outside of public health. People like Strive Masiwa, people like President of the African Exim Bank, Benedict Oraman, people like Donna Kaburuka, people like Vera Songwe. So this will be a platform where it is cross-sectional and multi-dimensional. That way we all come together as Africans and find innovative ways to address our public health challenges on the continent and actually advance public health. There are 3 elements to good healthcare. You must have good public health practice, you must have good health systems, and you must have good clinical services there. If you do not combine all 3, then you continue to suffer and lag behind on your ability to provide quality healthcare to the people and the citizens of the country. So the conference will aim to address all these different components, but with a focus on the need for Africa to have a new public health order, which is an order that says that we have to rely more on ourselves in terms of vaccine production, diagnostics, and pharmaceuticals. We have to increase our workforce Okay, and actually, Africa CDC is thinking of, is planning, not thinking of launching an African epidemic service program, which would be like a core of an elite force that would actually be ready to fight these diseases. We started this discussion by collectors referring us to the Marburg outbreak in West Africa. We have that all over the continent, I think, and all over meaning that you have outbreaks, whether they are new viruses or old viruses, all over, and they are very disruptive. The continent would not achieve its Agenda 2063 without a very strong public health agenda. That is what this conference will strive to do.
Okay, thank you very much, John. We have a question that's coming in from Bonisile Makubu from the Times of Eswatini. And she says, which vaccine between Pfizer and Johnson & Johnson is most suitable to be mixed with AstraZeneca? And this would be for those who only took the first dose of AstraZeneca. And also, how long after that first dose can that be done?
So the interval between the first dose and the booster, as I've said, ranges between 4 weeks to 6 weeks. I think we've addressed that. Now, any of those vaccines will be, the best vaccines that you have to use as your, what do you call it, a second dose or whatever, is any vaccine that is available. They will do the same thing, because remember, your immune system, your B cells that produce the neutralizing antibodies have already been primed. Okay, and if they are now provoked or challenged by the second dose, be it the Pfizer or AstraZeneca or, I beg your pardon, the Johnson & Johnson, the boosting will be just as similar. And we have seen studies that have been conducted that clearly speaks to that. I mean, and published studies that have been peer-reviewed speak to that. So I think if you have an opportunity to get your Johnson & Johnson, take it. The beauty with Johnson & Johnson is that is, again, as I said, it's one shot. So you just get it as if you didn't even get the AstraZeneca vaccine. But again, respect that period of times of at least 4 weeks to 6 weeks, so that your immune system would have matured enough to allow for a strong second reaction.
All right, thank you. Judith Akolo has come back, and she's with Kenya Broadcasting Corporation. And she says, my other question is that most public health is donor-driven in most of our countries in Africa. So will the meeting in December also urge African states to begin to fund public health?
Absolutely. It's one of the 5 pillars of the new public health order, Judith. I mean, the first is that we should consider strengthening our public health services as an investment. And to do that, I mean, the only way to sustain your own health security is to invest in it and not wait for donors to come in there. I think that is clear. As you know, Judith, President Kagame is the envoy, the champion, I beg your pardon, in Africa among the head of states that is promoting health financing. Then the second pillar of that new public health order is workforce, as I indicated. Then the third is what we call respectful partnerships. So partnerships that will align with the vision of where the continent is going. And then you have workforce development, which I've explained extensively, and then African manufacturing. Those are the 5 things, major things that will be discussed during the conference. And then subsequently, the impact of COVID on other diseases on the continent, like the TB, the HIV, the malaria, and others. So I think we are looking forward to a very, very exciting conference, very, very exciting conference. It will be a new conference, a conference that will promote new public health leaders and new researchers. The second conference, we hope, will be face-to-face, because there's nothing, in my view, that replaces a face-to-face conference there. So I think we'll start planning for that face-to-face conference even in December, and with the expectation that everybody would have gotten their vaccines, or anyone who wants to get a vaccine would have had the vaccines.
All right, thank you. We have questions coming in from Sarah Jerving, who is with DEVEX. So Sarah says, the COVAX facility set up the no-fault compensation program for those who received free COVAX doses and then have severe side effects. Does the African Union have a similar mechanism for those to receive compensation if they receive the J&J doses and then have adverse reaction? And then separately, she says, what do you think about health insurance companies offering insurance plans for medical coverage for people who might get severe reactions to a COVID-19 vaccine? Is it necessary and is it ethical? So those are questions coming from Sarah Jerving.
Yeah, I think, can you hear me, Wayne?
Yes, I can hear you. I can hear you.
Wonderful. Absolutely. We just the indemnification, the no-for composition, everything else that vaccines that come through COVAX are providing, the AVAX is providing. So it's just the same. So with respect to the insurance company, that is not a question that I've given thoughts to it. And I don't think I've invested in understanding how that area will work. So unfortunately, I cannot address that at this point.
Okay. Ndei Sisai, good morning or good afternoon, depending on where you are. Please come in with your question and just inform us of your news agency first. Good morning, Ndei. All right, I think perhaps our colleague might be having problems because I see that his microphone is unmuted, but we cannot hear him. So Ndei, may I ask you please to send in your question to that WhatsApp number, which is +251 94 550 2310. So we don't have any more questions that have come in on our platforms, but while we wait for our colleague Ndei to send in his question, and also perhaps for other colleagues who are still thinking through their questions to send them through, let me ask you a question of my own. And this is in relation to the vaccination for pregnant mothers. I've seen on a number of platforms, people really being unsure of whether pregnant mothers can now get vaccinated or not, because initially they had been informed that pregnant mothers were not suitable candidates for vaccination. So can you update us on what is the status now? Can pregnant mothers be safely vaccinated?
Yes, they can and they should go out and get their vaccines. We should be able to issue guidelines to that effect in the coming weeks. The US CDC has already issued such guidelines, and we will be issuing very similar guidelines. So the short answer, Wayne, is yes.
All right, Coletta has sent in another question. Ndei, please make sure that you send in that question to us. We are waiting for you. So Coletta says, kindly explain what explains vaccine hesitancy that we are witnessing in some parts of the continent, and how can we solve this so that we can quickly reach herd immunity?
So vaccine hesitancy is human behavior and is influenced by all of us, all of our own behaviors, where we spread wrong information. And I've always said on this platform that we can start a movement and a campaign where we say is that when I receive any false information, any misleading videos, I just delete it. I don't forward it, even to my friend. Okay, because that is the intent of those who create those misleading misinformation. They know that when I send it to Wayne will look at it, and even if she doesn't believe, she will be ridiculous, she will send it to the next person. Then the next person will send it to the next person. And this is not a transmission chain that speaks to the fact that they endorse it. It's just, but by transmitting it, they are spreading it, and it becomes a crystallized in people's minds. So it's a behavior issue. So that is one. The second thing about vaccine hesitancy is that it's not static at all. I mean, we have seen countries where initially there was a lot of resistance, and then subsequently, as campaigns were made and information sessions were organized, the situation changed. Côte d'Ivoire, we all know the situation, they got vaccines, the AstraZeneca vaccines early on. very few people show up to get a vaccine, but with the government conducting campaigns and the Ministry of Health, these vaccines were gone in no time. Senegal started off doing about 1,000 to 2,000 vaccinations a day, and now there are about 50,000 vaccinations a day. So I mean, situation changes very, very quickly there. And we see this in Nigeria. Nigeria has used up to about 99% of all its vaccines that it arrived there. When we conducted a study in last year, and a study that I think DEVEX actually carries some of that story there, where we surveyed 15,000 people across the continent in 15 countries, and the vaccine acceptance rate at that time, the theoretical acceptance rate was between 60% to 95%, okay? And we see that study reflects what we are seeing on the ground there. So overall, as a continent, I don't think vaccine hesitancy is the challenge we have. Vaccine predictability and access is the real challenge. If you give us vaccines in a predictable manner, like now that we know when the AVAC vaccines will be arriving, we will be orchestrating a campaign together with you, together with the civil society, together with the communities, religious leaders, in the coming days, in a way that it's a sustained campaign. It is based on facts. What I actually would like to characterize that campaign is that let's spread facts, not fear, about vaccines. I mean, vaccines save lives. I think we should spread facts, not fear. If we do that, then I have no doubt that people will see how vaccines have saved their loved ones and how hospitals are beginning to ease down because of people going there for hospitalization. There'll be less people going in for hospitalization, and they will actually go get more vaccines there. I remain very optimistic. Will there be a pocket of people that will continue to dig in and not want to get vaccines? Yes, but those will be in the minority. Okay, and I think then the majority would have created that shield, that herd immunity that we are all preaching and striving to achieve, and that's the way you get you eliminate this virus. Remember, this is public health. Public health is not clinical, which means you have to treat everybody. Everybody must receive a vaccine. If I immunize 80% of people in Addis Ababa, I'd consider that success. Have I immunized 20% of the people? No. And is that a threat? Definitely so, but you have actually blunted the spread of the virus. So vaccine hesitancy, in my view, in Africa is something that can be dealt with, and we will deal with that. But let's spread facts, not fear. And let's take it all upon ourselves to spread facts and not fear.
All right, thank you for that. Let me try and get Ndei to speak to us again. Ndei Sisai, can you hear us? I can see you've unmuted your microphone. Please go ahead with your question. No, I'm sorry, we still cannot hear you. Please try to utilize the WhatsApp number to send in your question. Let's move on to Simon Ateba. Good morning, Simon.
Good morning.
Morning. Please tell us your news agency. Please tell us your news agency and go ahead with your question.
Yeah, this is Simon Ateba with Today News Africa in Washington, D.C. I'm just joining now because it's like 5 a.m. here, so I don't know if you've answered this question. I just wanted to ask a question about the vaccine to people in Tigray in northern Ethiopia. I don't know if you can give us more details. Do they have access to vaccine there, especially the vaccine that was given by the US through COVAX to Ethiopia? Thank you.
So Simon, thank you for waking up early in the morning I believe you're in Washington, D.C. to join this call and for being always consistent on this call. Unfortunately, I don't know how the government of Ethiopia has distributed those vaccines across the entire country, and not just only in Tigray, but across Ethiopia as a whole. So I'm sorry, I would not be able to address your question appropriately.
All right, thank you. We have one question coming from Esther Nakazi, who is a freelance journalist. Are there any innovations from coming out of African countries during this pandemic that the Africa CDC is celebrating. I think that she's talking to positive and successful innovations that have come out of Africa that you would like to share.
No, many. I think we can spend the rest of this our time discussing the innovations there. I mean, before the pandemic hit, it was very difficult to go anywhere across the continent to buy something that was made in Africa in terms of the personal protective equipment, right? Now, many countries have produced that, okay, that is, and it has created jobs, okay, and then it has actually facilitated access to those personal protective equipment. The masses, I remember early on, to have a mask, you have to wait for it to be imported from China. Okay, so China and India were the kitchen for producing those things that we needed on the continent, but not longer the case. So that has changed. In the area of diagnostics, there are at least 4 countries now that are producing diagnostic tests, where previously there was none. I think that is the Senegals you've heard of, the Morocco, Kenya, and I believe Ethiopia. I mean, you recall Ethiopia just a few months ago said they were going to start producing millions of COVID tests there. So that is remarkable. Vaccine production. You see, you've heard us say that about 4 countries in the coming months will start producing COVID vaccines on the continent: Egypt, Morocco, Algeria, Senegal, South Africa, and Rwanda, all geared up, and many others like Uganda, Nigeria, Ghana, all on the pipeline. So those are great innovations there. So if we do all of these things, the way that we will fight the next pandemic will be very different from the way we are fighting this pandemic, because we are not going to be scrambling anymore to get vaccines or begging for vaccines from elsewhere. The platform, the AMSP.Africa platform, which is the Amazon.com for Africa, for commodities. And every day, and I mean every day, I go on that platform just to amuse myself to see the wonders of how that platform has united the continent in terms of procurement of commodities. It is our wish and hope that those kind of platforms, including the AVAC platform, which is the first time in the history of our continent that the continent has come together and pooled itself collectively to approach a vaccine acquisition, and they have acquired 400 million doses of vaccines. If you put that in the real context of everything, this is a historic moment and a game changer. Again, put that in the context of how many vaccines we are trying to get. We are trying to acquire 1.6 billion doses of vaccines. And AVAC is saying between now and next year, secured, signed vaccines, 400 million secured and signed vaccines will be made available by Africans to Africans. That is significant. So that we have to put that in the context of, say, somebody donating 5 million doses here and 2 million there. We welcome all of those, but the really game changer on the table is the AVAC donations for now. Tomorrow the situation might change, but today that is it. So that is a great innovation that must be celebrated and talked about. So I can go on and on. Many other things that have come out, and I didn't prepare to answer that question, but each day I count those. I reflect on one of each of those, and I'm just full of joy. I mean, the continent was actually in a jubilant state over the weekend, not only because they were receiving the vaccines, but because it was their vaccines. It was the vaccines paid for by African taxpayers, organized by Africans, and for them, over hard discussions for them to have the vaccines on the continent. It is the first time in my 30 years in public health that I'm seeing that happening on the continent. So those are all innovations that we should celebrate.
Indeed, thank you very much for that. Sarah Jerving has come back with a second question, and she's with DEVEX. She says, how likely is it that the African continent will be able to reach the goal of vaccinating 30% of the overall population by the end of 2021?
So we at Africa CDC maintain that goal, that we must, from a public health perspective, that we must and should do everything possible to get to 25 to 30% of the vaccination by the end of the year. Again, this is an emergency. This is a virus that is spreading very quickly, And this is a virus that at least for us on the continent, has a very unpredictable and uncertain trajectory. Look at what is going on in the United States. The United States has immunized about 50% of its population, but suddenly you see that because half of the population has not been immunized, you see that the challenges that they are facing there. So you should be able to extrapolate that on the continent and say, well, if we do not do that, then the chances that we are going to really, truly live with this virus on the continent become every day a possibility, which we don't want to see happen there. So in public health, good public health practices dictates to us that we should set the goals and not set the goals because we believe that we should set very minimal goals and try to, or set the bar loads that we can cross it. We should set the targets based on science and try to achieve that. If we do 25 to 30% by the end of the year, then a vast majority of at least half of our target will be achieved. That way, we begin to minimize the spread of the virus, unlock our economies, and then again build the momentum towards next year and do the remaining 60%. Shall we limit ourselves to 60%? I don't think so, because of what new knowledge that we now know about this virus will probably dictate that we go even beyond 60%. But let's try to get to that target incrementally, set ourselves a target of 25 to 30% by the end of the year. Next year, we try to do more, and then based on the pathogenesis of the virus. When we set that target last year, if you recall, we didn't know about the variant. Just to put it in the right context, the wild type, the variant, or the ancestral virus that first was spread last year, had the reproductive ratio, or the reproductive capacity of only 2.5, which means one person infected was able to spread it to 2 more people. The Delta variant has a reproductive value, what we call the R naught, of about 6 to 8. Okay, which means that one person or anyone infected can spread it to about 6 to 8 more people there. So all of that, we need to factor that into where we need to be to achieve our herd immunity there. But when we did our calculation last year, was strictly based on the knowledge we knew at that time. But we have new information now. But the goal, our goal should be clearly, let's get 30% of our people, 25 to 30% immunized by the end of the year, do everything possible to build the right partnerships to achieve that goal.
Thank you very much, John. Simon Ateba from Today News Africa in Washington has come back with a second question. He says, last week you met with Samantha Power in Addis, and she's the USAID administrator. What did you discuss? And did she make more pledges for vaccine donations from the Biden administration?
Yes, it was a very good meeting with Samantha Powell, and if you followed the news, she issued, the USAID issued a press statement announcing about $750 million for the recovery to fight COVID outside of the United States. And of that, almost about 500 million was for Africa. One thing we discussed, which was reflected in that press release, was that they need to align whatever USAID was doing within the continent in the context of the joint continental strategy that our head of states have endorsed. And she was very welcoming to that. And they actually reflected that in the press release that was issued. We agreed further that in the spirit of the new public health order for Africa, which I outline here, that AID and Africa CDC will continue to work very, very clearly so that they align, the USAID align their support for the continent through the various vehicles, mechanisms that Africa CDC and the vision that Africa CDC was tracing. I think it was a very productive meeting, very open meeting, very transparent meeting, and I think I really salute time that she took to actually have a very honest conversation with Africa CDC and the way forward.
All right, thank you very much, John. We are almost at an hour that's allocated for this program, so perhaps let me give you these next few minutes to wrap up with your main headline points from today's briefing.
No, thank you, Wayne. I mean, as always, let's focus on vaccines and about vaccine hesitancy issues on the continent. That key message is that it is all our responsibilities. to fight and win the war against vaccine hesitancy, especially now that vaccines are beginning to flow steadily on the continent. What would be a tragedy is if vaccines arrive the continent and we struggle to immunize our people with. I think that would be, history would judge us very poorly, that we didn't do what we had to do. It's a collective responsibility and collective accountability that we should take this very seriously. I'm sure that we are all leaders in our own rights, that if we take upon ourselves to go to our communities and talk to our religious leaders and say, look, when you go to your Friday sessions on Friday or on Sunday, you go to church, make sure you make that pronouncement. Tell your audience that they should go get their vaccines. It is by getting the vaccines that they protect themselves, they protect their loved ones, they protect their community and protect their countries. That would be very powerful. And they should, in that setting, again, work with us, the public health agencies, and not just Africa CDC, but the respective public health agencies in each country with a team of let's spread facts and not fear. Okay, there's a lot of fear around vaccines that is completely misleading and is manipulated. So let's spread facts and not fear. So again, I look forward to everybody being a foot soldier in fighting the war against vaccine hesitancy in Africa.
Thank you very much. That was Dr. John Nkengasong, and he is the director of the Africa Centers for Disease Control and Prevention, the Africa CDC, which is an institution of the African Union. And he's just summarized there, highlighting the need for us to talk about the vaccines. And he also mentioned that the vaccines that have been acquired through African mechanisms have started circulating and being distributed throughout the continent. So that is very welcome news. And also that Africa is still targeting that 30% of vaccination across the continent by the end of the year. And then, of course, he highlighted something that is close to my heart as someone who came from the media, to say that we do have a big role to play in spreading facts about COVID-19 and about the vaccines and everything that is coming out with regards to this pandemic. And of course, the Africa CDC remains a very credible source of information around everything COVID-19 in Africa, and they are available on www.africacdc.org. So hopefully you will be consulting that rich resource for information. But it's time for me to sign out. My name is Wayne Musabayana, and it has been a pleasure being with you. On behalf of the Africa CDC, Dr. John, and all colleagues from the African Union behind the scenes, I say goodbye, and let's meet again next week at the same time. Bye-bye for now.
Bye-bye.